C. colitis. Also known as C. diff colitis, C. difficile colitis, necrotizing colitis, or antibiotic-associated colitis. Pseudomembranous colitis is a condition of inflammation of the colon associated with an overgrowth of the bacterium Clostridioides difficile or Clostridium difficile. C. diff causes severe diarrhea and colitis. Colitis is an inflammation of the colon large intestine. The overgrowth of C. difficile is usually caused by antibiotics, especially the orally administered ones, and a long stay at the hospital. C. difficile occurs because antibiotics change the large intestinal bacteria, thus allowing the C. difficile bacteria to overgrow and produce its toxin. Pseudomembranous colitis is common in patients older than 60 years. C. colitis symptoms. Usually, C. colitis appears with the following signs and symptoms: watery diarrhea, loss of appetite, abdominal pain, cramps, and tenderness. Colon colitis, inflammation in the large intestine, a large amount of mucus and pus in stools, mild to moderate fever, nausea and sometimes vomiting, dehydration due to persistent watery diarrhea. In greater virulence, sepsis can occur. Sepsis is the body's potentially dangerous overreaction to infection. C. colitis starts within 1 or 2 days of starting taking antibiotics. It may last for a few days to months even after stopping taking antibiotics. Causes of C. colitis. Usually, the colon large intestine contains a number of different types of bacteria, which are present in a healthy balance. There are some health-friendly as well as toxic bacteria in the colon. The health-friendly bacteria generally check and limit the overgrowth of toxic bacteria and their activities. This balance is disrupted by the use of antibiotics, thus resulting in the overgrowth of the C. difficile bacterium, which is infectious in nature. The production of toxins made by C. difficile rises to a high level, which damages the large intestine and results in severe diarrhea, inflammation, pain, and dehydration. As the use of antibiotics causes C. colitis, we need to point out those antibiotic medicines, which generally cause this condition. These medicines drugs include fluoroquinolones. The fluoroquinolones currently available in the United States include ciprofloxacin, gemifloxacin, levofloxacin, moxifloxacin, norfloxacin, and ofloxacin. These agents are well absorbed orally and well tolerated with a low rate of adverse effects. Among these drugs, ciprofloxacin and levofloxacin are known to cause difficile colitis. Penicillins. Penicillins like amoxicillin, ampicillin, augmentin, unicin, dicloxacillin sodium, etc. cause difficile colitis. Clindamycin. Clindamycin, also known as clethodim, is used to treat certain types of bacterial infections, including infections of the lungs, skin, blood, female reproductive organs, and internal organs. Use of clethodim may cause an overgrowth of C. difficile bacterium in the colon. Cephalosporins. Cephalosporins are a large group of antibiotics that belong to a class known as beta-lactams. These drugs are used to treat bacterial infections including ear infections, pneumonia, and other upper respiratory tract infections. Cephalosporins like such as cefixime suprax may allow C. difficile to overgrow and cause colitis. Preventive measures. Patients, their friends, family members, and health service providers should take strict hygiene initiatives, and follow infection control guidelines in hospitals and nursing homes. Some important preventive and preemptive measures to check the infection spread are as follows: avoid unnecessary and excessive use of antibiotics. Antibiotics are often used unnecessarily to treat viral infections, which is quite unhelpful. Viral infections are never treated with antibiotic drugs. Antibiotic drugs are useful only to kill bacteria. The unnecessary use of antibiotics will kill healthy bacteria present in the colon. For example, some physicians prescribe antibiotics to patients with measles with the intention to relieve the patient. Though measles is a viral disease, there is no specific drug discovered to treat measles. Moreover, antibiotics are also used for a long time to treat bacterial diseases. The excessive use of antibiotics is harmful as well. Hygienic measures. Healthcare givers should take hygienic measures before and after treating each person in their care. In case of a C. difficile outbreak, using antiseptic soap, non-alcoholic hand sanitizer, and warm water is a better choice for hand hygiene. An alcoholic hand sanitizer would not be an adequate choice because it doesn't effectively destroy C. difficile spores. Visitors from the outdoors also follow these guidelines. Sanitary workers should wear disposable gloves and isolation gowns while cleaning the patient's room. Contact precautions. People who are suffering from C. difficile should have a separate room or only share with those who have the same illness. Healthcare givers should not touch the bed rails, bedside tables, and chairs used by the patient. If so happened, wash their hands before and after providing service. Use of antiseptic cleaning agents. C. difficile bacterium is resistant to routine cleaning products. Cleaning agents containing chlorine bleach should be used to disinfect the surfaces. Apart from the case of C. difficile, these measures should be taken in all types of healthcare setups.